Welcome to Beyond the Medical Algorithm, a podcast by the Philly Wellness Center. Join us on a journey through the too often neglected path to wellness, where we celebrate the human body and all things natural to illuminate new roads to health and happiness. Holistic is the name of the game, and I'll be talking to fellow experts and enthusiasts to rejoice in healing and revolutionize the way we approach therapy. I'm your host, Catie Harris. On today's episode of Beyond the Medical Algorithm, we're joined by Dr. Kevin Smith, a distinguished facial plastic surgeon and ENT and the founder of the Smith Sinus Migraine Institute. He's one of the few facial plastic surgeons who is board certified by both the American Board of Otolaryngology and the American Board of Facial Plastic and Reconstructive Surgery. Dr. Smith is a pioneer in the field, particularly noted for his revolutionary approach to treating migraines through surgical interventions aimed at correcting nasal abnormalities. His groundbreaking work in this area has not only challenged conventional migraine treatments, but also provided relief to thousands of patients. As a fan of this podcast series, Dr. Kevin is eager to touch base on the procedure that normalizes the nose to achieve these results, and no doubt that his insights will prove to be incredibly valuable. Welcome, Dr. Smith. Thank you so much.
Thank you very much for having me. I'm excited.
Yeah, I mean, this is definitely a topic that, I've been in medical for 28 years, and this is a first for me, so I'm really excited.
Good. I've been in about the same amount of time, 30 years, yeah.
All right, so before we dive into the specifics of your medical practice, tell us more about what inspired you to pursue a career in plastic surgery and ENT.
Well, I can tell you it started in medical school. I loved the head and neck anatomy. It was very intricate and detailed. It housed all these senses, and I was fascinated by it. And then I heard that there was a specialty in it called ear, nose, and throat. Immediately went to the chief resident to see if I could scrub in cases to see how I liked it, loved it, got to know them, applied, got in. And then I did a fellowship in facial plastic surgery because I thought I needed to know how to do a good rhinoplasty, being an ear, nose, and throat doctor. And so the rest is history. Been practicing about 30 years and loving every bit of it.
When you say it like that, it seems kind of like more doctors should probably do ENT and plastics together, especially plastic surgeons.
Yeah, well, I do facial plastics. The thing I like about it, it's limited to the face. That's my area of expertise. I don't do any body plastics at all. And I like that because at this stage in my career, I've basically distilled it down to eyelid surgery, facelifts, and nose jobs.
So how did you discover this connection between the nasal abnormalities and migraines? Like, where's that connection?
As a sinus surgeon, I used to do sinus surgery on patients, and I would just ask, do you have headaches? And they would say, yes, I do. And so over and over, I would do the surgery and find that the headaches would go away. And it wasn't until I really looked at the data that I found that over 90% of the people who were coming to me actually had a history of migraine. And so I was very perplexed by that. I'm like, okay, wait a minute. I was taught in medical school, migraines are in the brain. So if these people have migraines and I'm fixing them with the nasal surgery, I started calling them migraine imposters, migraine-like headaches, migraine sort of like headaches, just to get the migraine in there, because people with migraines, they don't come if you just stick the headache. Oh, I don't have headaches, I have migraine. So I happened to be on the doctor's show one time, and I told people on the show that they could have access to my expertise if they would just get a sinus scan, send it to my office, I'll look at it to see if you're a candidate.
Oh my God.
You can imagine I got flooded with these scans, right? From people who all had migraines. And of course, I don't diagnose migraines. Migraines are diagnosed by some of the top neurologists in the country. And these people all met the criteria and they have the diagnosis. So they're sending me these scans. I look at all the scans. And lo and behold, almost all of the scans have the same abnormalities as these migraine imposter people that I'd been treating all these years. And that's when I sat down and looked at the numbers and said, you know what? This is incredible. I'm actually curing migraine headaches. There's an association here. And so from that point on, I've been telling people that I eliminate migraines. There is a connection between the nose. And the easiest way to get somebody to really understand it is to reflect back on the earliest COVID swab test. Those things hurt. Come on now. And when did it stop hurting? When they took it out. So people with abnormalities as a result of nasal injuries, they don't have to be a broken nose, but just getting hit on the nose. can cause these abnormalities. And these abnormalities act like a permanent COVID swab in your nose. It continues to hurt until voila, Dr. Smith takes the problem, corrects the abnormalities with I call it a normalizing procedure. I'm not doing anything abnormal. I'm actually taking an abnormal nose and making it normal. And as a result, 90% of the people that I operate on don't have another migraine.
Wow. That's really impressive. So is it always like injury, or is it something that can develop over time?
Majority of them are injury, because you can figure that the first trauma is coming through the birth canal. The face is pressed against the mother's sacrum. And as we grow older, you have bicycle accidents and then sports related injuries. And then you drive in your car and you have a car accident. But I'm sure there's a small component of people who have hereditary factors, meaning everybody in the family just happens to make a deviated septum or big turbinates or whatever the combination of the abnormalities are. It happens to be more frequent in certain family members. So that might be a genetic component.
Now, when you made this connection, was there anything that was in the literature, or are you like literally the first person to discover this?
I don't know of anybody else that's doing this. I can tell you that in the ENT world, it's widely known contact headaches caused by deviated septum. But nobody's ever attributed migraines to some of these abnormalities. So I took that information, which is widely known in the ENT literature, and applied my innovation to it. And that's when I came up with, wow, not only contact headaches, but migraine headaches are caused by these very same abnormalities.
Now, did you get pushback from your peers when you first brought this up?
Well, I have an unpublished paper that I sent to the Otolaryngology Journal years ago. It did not get published. I can't tell you why, but it talked about the role of septoplasty in suspected migraine headaches, where it showed that I got 88% success rate in eliminating them. And it's one of those areas that it's cutting edge. And when you say migraines to an otolaryngologist, even if they see abnormalities on a sinus scan, they will say, oh, you need to go see a neurologist. They don't want to be responsible for it. And if I go to a neurologist, which I have, and I say, I know you don't help everybody. I'd like to work with you. I see you. Your focus is migraine headaches. Let's work together. They're like, this is very controversial. We don't believe we see a lot of that. You have proof. So right there, there's a disparity. You get to believe something, but you want me to prove it. And I'm coming at, let's just check it out together and see. I always joke I have a neurology colleague of mine, and I joke with him all the time. I'm trying to win him over. He knows what I do. He sends me patients. He doesn't know to the extent that most, if not all of these people have the abnormalities. And so I'll call him and say, hey, I really would mind sharing a Nobel Prize with you. Let's work together and let's do this, because there's just a prize waiting, and they'll give it to two people for working together, but he doesn't quite get it. So I tread lightly, but I would love to have a neurologist. If there's somebody out there that wants to work with me, win a Nobel Prize, just give me a call.
I love it. So how do you get referrals? I mean, it's one thing to go in the doctors and get thousands of people sending you, but how do people know to send? What type of patient do you take?
Like I said on the show, that to find out if you're a candidate, send me a sinus CT scan. And since we're talking about algorithms, let's talk about that, since that's the name of the show. I was thinking about this. The normal algorithm for a migraine patient is to go to your primary care doctor for a severe headache. Your primary care then give you some medication. Once it becomes chronic, then they refer you to the neurologist. The neurologist then gets a brain scan. Brain scans in migraine patients, only 5% will show a tumor or an aneurysm to explain the migraine. That leaves you with 95% normal brain scans. I think that what needs to be interjected at that point is, after you get a normal brain scan, which I think is very important, you need to get a sinus scan. That's what needs to be placed in the algorithm of working up a patient with migraines. And then, unfortunately, I'm the only person that can look at it at this point. I haven't trained anybody, and I know what to look for because I had countless numbers of CT scans where I receive a report, and the report mentions nothing of the abnormalities I know cause the problem. So I have to look at it, and then I have to do the procedure. I've spent years developing the procedure. It's septoplasty, it might be turbinectomy, it may be combined with balloon sinuplasty. However, it's done in such a way, a very intricate and detailed way, that I know that I can give the very best chance at eliminating the migraine. It's not just for breathing. Now, the byproduct of my procedure is better breathing, sleeping better. Sometimes I might get rid of sleep apnea. I'll help with ear symptoms like dizziness and ringing in the ears and muffled hearing that goes along with it, postnasal drainage. All those things get better, including sinus infections. But the primary focus of my Smith Sinus Migraine technique is to totally eliminate the migraines. So back to your question about how do I get them? Word of mouth is really big. I might go and have a television segment. I did one in Oklahoma last September that was very well done by a patient who was an anchor on the show on the news. And she featured another patient there in Oklahoma. And ever since then, people from Oklahoma drive to the Woodlands, Texas, 6 to 8 hours like it's nothing in droves. And it really impressed upon me the power of a small community because all these people go to schools together, church together. They know everybody when they go out to eat or whatever. And they come in the truckloads to Texas. So much so there was a point where I was seeing more people from Oklahoma than I was seeing from Texas. So mainly it's marketing. Social media plays a big role. I have my Facebook page. Smith Center Facebook page has dozens and dozens of video testimonials where people can go and just listen to the stories of people who have suffered needlessly for years, finally found me, now are doing better, living their best life. And I found that marketing to the end product is the best way. The end person is the best way to do that because it's very hard to change the referral patterns of doctors.
Yeah, and this is a really hot group in that they are desperate for a solution. If you've ever had migraines and chronic migraines at that, and you could literally be out for days with a migraine headache. So they're desperate. And I can imagine, especially knowing that you're out there, but the only way to get to you is to hit everybody. You need incredible marketing.
Oh,
right?
I know. Think about it. There are 40 million people in the United States, and there are 1 billion people in the world that can benefit from what I do.
And you're one man doing the surgery.
Yep, which is why I'm looking for the ideal partner. If anybody can get me in touch with Melinda Gates, she would be excellent. I think Mackenzie Scott would be excellent to partner with because migraines impact women more so than men. And I think those two in particular would understand the impact they could make in the world if they would have partnered with me and help launch this worldwide. It's going to be fun.
Yeah. And so if somebody, let's say they've been through traditional migraine treatment, they hear this and they're like, I had a nose injury at some point. Would they be able to get a sinus scan done without any, would there be insurance complications there?
There may be some pushback. Sometimes primary care doctors they're dinged, as they say, for ordering too many tests and things. I would say that what we tell our patients is go to your primary care doctor. We can email them the code that's necessary. It's a sinus CT scan. We can email them the code, show it to your doctor. Tell them that you have headaches and facial pain. Let's go that route. Because as soon as you say migraine, they're going to want to get a brain scan. And I have some patients that have had 5, 6, 7, 8 normal brain scans over the course of 20 years. So push for that. Say you have headache and facial pain. You'd like to have a sinus scan. And quite frankly, a lot of my patients say, I always thought it was in my nose. It always is around the nose or the eyes or the forehead or the cheeks or the temples or the top of the head, the back of the neck. And those are areas that abnormalities in the nose definitely can refer pain to.
Right. And traditional, just MRI wouldn't show you what you needed. You'd need CT scan.
No, I have had people, if you don't have a CT scan, that's a very good question. If you don't have a CT scan of the sinuses or can't get it, send me your latest MRI because oftentimes it will show me enough. I know what to look for on an MRI. However, when I need the detail of the sinus anatomy, the openings into the sinus, I need something a little more finer, but I can let you know you're a candidate. Matter of fact, I used to say, send me the scan to see if you're a candidate. If you have migraines and chronic headaches, you are a candidate. You need to send me the scan so I can figure out what I need to do because everything is customized based on what I see on the scan.
And how does insurance work with your type of surgery?
Insurance does cover it. That's a great thing. So you send me the scan with your questionnaire. We have a nice questionnaire that we have people fill out. I read the questionnaire, look at the scan, can develop the surgical procedure based on that. And then we just send that off and get authorization from insurance. So insurance covers that. So that's a good thing.
Yeah, that's amazing because they don't cover anything that's out of the ordinary.
It is out of the ordinary. However, I use sinus codes and nasal codes. It's just the way I do it is different. but I use the same sinus and nasal codes that general otolaryngologists would use.
So is there a balance to strike between the less invasive methods and the surgical solutions in treating conditions like migraines like this?
There are. I mean, when you consider there might be some elderly patients that can't undergo surgery or sickly patients who cannot undergo anesthesia, it's done under general anesthesia. It takes me about an hour to do. You'll see me back in about a week. And if you're out of town, you'll see me a couple times after that as well to make sure you're healing. And by the second day, most people are taking Tylenol. They say it's not really a painful procedure, it's more discomfort. And so, yeah, it really works out well. It really does. It's amazing.
What do you think are some of the common misconceptions that you've encountered in the medical community with this in regarding the treatment of migraines with nasal surgery?
Well, I've had neurologists tell me that you cannot cure migraines with surgery. You're giving out misinformation. And it's simply, I mean, at this point, that's simply just not true. I like to say this: neurologists are experts in treating migraines. I'm the expert in eliminating migraines, and because that's what I do. I mean, the 90% success rate, the numbers speak for itself. And that's the main thing, it's just a lack of understanding. You have to understand that a neurologist is not going to know much about the nose because they focus on the brain. I don't know a lot about the brain because I focus on the nose. So I'm talking about my area of expertise here, the nasal cavity. So it's just something that I'm looking forward to, spreading the word. I already can envision myself doing lectures at big groups, and I have to train other surgeons to know how to perform my technique.
Yeah, I was going to say, you need a fellowship.
Exactly. You got it. No, there will be a fellowship. There'll be a fellowship for those ENTs that are doing sinus fellowships right now. This will be an added fellowship to help train them in the sinus migraine technique. And it's very exciting. It really is, to know that you're an expert in something and you can train. I love teaching. I love lecturing. I love talking. I love, as we're on this podcast now, I love doing this stuff. Yeah, it's fun.
So how long have you been doing this procedure, and like around about how many patients are we talking?
Well, we're talking over probably 5,000 patients now. Again, I mean, in Houston alone, you're talking about what we have in the suburbs and everything, about 7 million people. So 10% of the population, that's 700,000. So I have 695,000 more to go to Houston. Yeah.
You might need a couple fellows.
A couple fellows, yeah. Yeah, so it's very exciting. And I'm talking to some companies right now who make the scanner that I use about partnering to get the message out. And so it's really taking shape to get the word out and to get with the right partners. But I would love to get a wonderful partner like the ones I talked about earlier that really I could sit down and talk to. They get it and go, wow, this is incredible, which it is. And to have the resources to just get the grant writers, get the money, the funds to build the different marketing campaigns, and then the training facilities and the fellowship program and the publishing and all of that.
It's exciting, but at the same time, it's like one of those things that I don't think the general public really appreciates or understands, because you come out with something like this, that you have 5,000 patients that this was successful for, so that it's proof enough. But in order to bring it mainstream so that everybody's doing it and everybody hears about it, and it's kind of like, why don't we know about this type of thing? The monumental effort that it takes to move something like this forward is like mind-blowing.
I'm glad you appreciate that. And I've thought what probably will happen is I'll go around and I'll start teaching at academic institutions the 4, 5, 6 sinus surgeries at Mayo Clinic, Cleveland Clinic, Johns Hopkins, at least at Stanford, Michigan. You get those done. At least you have those groups, those pods around the country. And then you do the same thing internationally. And that's the start.
Right.
But even that.
Yeah, even that. It's
I know.
And that's what kills me. So that it takes like 20 years for something to really come to the forefront. And it's just kind of like, oh, and even then, they'll say, oh, well, there's not clinical trials that have been done. And you're just kind of like, okay, well, they didn't do clinical trials on jumping out of an airplane without a parachute either. But we still, it's.
I'm going to use that one. You mind if I borrow that one? Yeah, but you know not to do it. You know that a parachute works. They didn't do clinical trials for that. So how about we just try it?
Right. So how about a particularly memorable case that you have where you corrected a nasal abnormality and it had a profound impact? Do you have a story like that?
It's so funny you ask. He was just in the office today. And he was with his wife because now his wife has headaches and migraines, and she's going to have her procedure. Kevin is from California, his wife, Patricia. Kevin had what's called hemiplegic migraines. And with that, let me just state that my procedure, although it's called the Smith Sinus Migraine Technique, this technique is applicable to every type of migraine that there is. I've eliminated all of them: hormonal, hereditary, ocular, abdominal, sleep migraines, those associated with Arnold Chiari's, those associated with neurological disorders like MS, Parkinson's, ALS, Crohn's disease, irritable bowel, essential tremor, seizure disorders that have migraines. And even if they don't, I think they all need to be screened because migraines are associated with over 75 different neurological disorders. And I do have an MS patient for a year and a half who has not had a migraine nor an MS episode. And I just recently scanned a Parkinson's patient who has the same abnormalities, and he's going to have his procedure coming up pretty soon. And on that same thread, I am trying my best to get to Michael J. Fox because I have been following him, reading about him. His first symptom was a headache and a tremor of his finger. And then I read just last year that he's had 2 septoplasties inside his nose to correct a deviated septum. And that tells me there's a residual problem that's likely causing his problem. And not that I can reverse his symptoms, but I'm pretty sure based on some of my patients who have had Parkinson's symptoms that went away, I can likely halt the progression of his disease. But back to the person. Kevin's from California. He had hemiplegic migraines. These migraines resemble a stroke. He had migraines as a kid. They got worse as an adult. They got to the point where he was having blackouts. He couldn't remember what he did when he went to work. He was getting up, going to work. One day, his wife said he put on his pajama pants and his work shirt, got the keys, walked outside, starting the car, ready to go. And she's like, "Where are you going, Kevin?" He doesn't remember. He was just that out of it from the pain. He had word garble. He had stuttering that happened when he had his migraines. And he had about 60% of the 20 most common Parkinson's symptoms. I remember going through those with him. And so it's been about almost 2 years now. And every time I just videotaped him a day. And when he starts to talk about it, he starts to cry because it's so emotional that he has his life back. It was so bad for him. He has a big family. He had to move towards his family and quit working because he would just walk off into the neighborhood, or they'd be at dinner one night. They said he just got up. They thought he went to the restroom. He was walking through the neighborhood and didn't even know what he was doing. He had to ask his wife. They had to videotape him and tell him this is what happened because he couldn't remember. And all that's gone. He hasn't had any blackout spells. He doesn't stutter as much. He said it's very, very faint. But he used to stutter. He couldn't get any words out there. He would just curse. And his wife even said, she called it his Tourette's, which then reminded me that migraines are related to Tourette's and facial twitching and things like that. So he was a dramatic one that has done very well. And then his wife got some upper respiratory tract infection and started getting these severe headaches and migraines, went to her doctor, went to the ENT locally there. They downplayed it. And she had to stop working. So for 8 months, she hadn't worked. And they just flew in today. She's having her procedure tomorrow. And they are just so thankful for finding me. His brother found me on the doctor's show that I mentioned. They found the videotape, sent it to him, and then the rest is history.
And all of this stems from a deviated septum.
A deviated septum is one of the abnormalities, the most common one. But there can be large turbinates, a deviated septum, sinus disease, a combination of all the above. I have had people with a normal septum that have had other abnormalities. Very rare. The most common by far is a deviated septum, though.
Okay. What is kind of the connection between the large turbinates, so the deviated septum, and the migraine?
Well, the air conditioners of the nose, they swell and shrink in response to foods that you might eat, atmospheric pressure, weather changes. Red wine can cause them to swell. A salty food or dinner or something like that with a lot of salt. Pregnancy can cause them to swell because of water retention. And the turbinates are very sensitive. Going back to the COVID swab test, when that swab goes in, you're touching that turbinate. In addition, the rest of the nose is very sensitive too, but the turbinates do not like to be touched. So when they're touched, you get the firing of the pain fibers and you get referral of that pain to different areas of the head. And that's the connection. And for those that have the hemiplegic migraines like Kevin, there's a condition called cortical depression where when the nerves fire and they go back into the brain, it's just like lightning you might see up in the sky that kind of spreads rather than one single lightning bolt, it spreads. And so cortical depression is when the electrical impulses kind of spread and they hit these other nerves and cause you to have these other deficits that might go along with the pain.
Okay. And so that's when you had mentioned hormonal headaches. I'm around that that period.
Yeah, around the menstrual cycle. That's right. The turbinates swell. You get more contact.
That makes sense. All right. So is this a surgery that you've been refining over the years? Is there like new advancements that you're making in your techniques and the way you're doing things? Are you always kind of improving what you're doing?
I am, exactly. I'm always improving what I'm doing. Are there things that I do now that I didn't do before? Are there things that I'm always looking at? I do know that sometimes people might get some scar tissue in the nose. And unfortunately, I had a woman who never had a migraine until she had nasal surgery by an ENT. And she had some scar tissue develop in the nose. And she had migraines that went on for 23 years that she never had before. So she sends me a scan. She comes in and I see this scar band and scar tissue in her nose, along with some other things. And I fix them and the headaches go. So that again tells you that the nose is very sensitive. And when you are operating on the nose, you need to be very tedious and careful and treat it with tender loving care. You just can't go in there and just do what you want without keeping in mind that you want to try to avoid tears with the septal mucosa or adhesions forming and things like that.
All right. So what is your legacy going to be?
Well, I'm going to be the doctor that brought a migraine cure to the world. And I'm going to be the one that's going to shift migraine care from neurology. They'll diagnose them. But as far as eliminating them, this is a new specialty in ENT that ENTs don't know that's coming, but it is. It's here. And that'll be my legacy. And then just when I thought that that was enough, knowing that migraines are associated with these other neurological disorders and knowing that I've screened several Parkinson's patients, they have the same abnormalities. I have the MS patient. She doesn't have MS. I had an Asperger's patient. He's well enough to work now and hold a job. I have patients with tremor, essential tremor. The tremor has gone away. The thing about me is very curious and I listen to my patients. One patient, I called her up on a telemedicine call. How you doing? I'm doing great, Dr. Smith. No more migraines. But you know what? I'm like, what? I've had constipation since I was 19 years old and it's gone. So I'd make a mental note of that. I'm like, okay. The little girl in Louisiana who came in with migraines and also said, I have IBS, irritable bowel syndrome, and I can't eat pasta. I cannot eat pizza. And my stomach is always a little bloated and she's thin as a rail. She gets a procedure. 6 weeks later, 3 months later, I don't have any migraines, Dr. Smith. Oh, but Dr. Smith, guess what? I can eat whatever I want. I tried some pizza. I tried pasta and it's going away. So there's a lot of work to be done with that connection. Like, what is that? What's going on?
Yeah, it's not brushing it off and just being like, oh, that's just crazy. But, like, how does this actually, how is it connected?
What's the connection? And so that'll be my legacy. Curious doctor that still was like a kid figuring out things. People say, I always say, when people say, I think outside the box, I'm like, I don't know what a box is. So let's just go there. So he's the one doctor, he didn't even know what a box was. And it's true. I truly practice medicine and I observe the results. And that's where I got where I am today. I had a great foundation in my medical school, but you have to question some things. When you see it and it's right before you, you have to look at it and go, hold on a minute. These aren't migraine imposters anymore. When I have a randomized sampling of people all across the country sending me scans and they all have migraine. So it's just incredible. It's wonderful that I was able to find my purpose and my passion in life. That's as simple as I can put it. He found his purpose and his passion in life. And it's rooted in the fact that he can use his hands and his mind to help restore people's lives. That's the greatest gift I can give somebody because I love my life. I really love my life. I've lived a charmed life, as I say, and I want everyone to live the same wonderful life. We're only here for a certain amount of time, and you ought to be able to just live the very best you can.
Yeah. And you picked a good field for that because these people are desperate. So for those people that are listening that are interested in perhaps what they should do next or how do they get in touch with you, what should they do?
Well, you can call the office at 713-795-0600. You can also go to the website, kevinsmithmd.com. You can then go to the Facebook page, look at all these wonderful testimonials, and that's Smith Center Otolaryngology. Instagram has some nice posts on there at Smith Center. But those are the best ways, and we would love to hear from you. The whole staff is very, we're all in the same sort of boat. We love helping people. We'd love to get the scans in the mail. It's like Christmas. Like, how many did I get today? Oh, you got 4 today, Dr. Smith. Okay, great. So I go through them, I look at them, and I call the patients, let them know they're candidates. They have it, I can fix, and we go from there. It just really is a wonderful specialty. And, and you mentioned that I went into the right specialty. And there were times where I thought I might go into anesthesia or orthopedics. Everything had to work for me to get to this point. If I don't go into ENT, I'm not talking about migraine. And who knows when down the line somebody might have discovered it, if ever. But I happen to go into ENT. I love ENT. I'm an astute surgeon. I'm critically thinking, and I think that's my facial plastic surgery that's helping out the sinus surgery part of me, because I'm looking at details and intricate details and small things on the scan and what could be causing this and what do I see here. And so patients who say have done well for a while and then they come back 6 months later and they're having headaches again. Well, I know to look for certain things. You have to really scrutinize that CT scan. So this is fun.
I love it. Well, thank you so much for sharing this with us today, Dr. Smith.
You're very welcome, and thanks so much for having me.
Beyond the Medical Algorithm is brought to you by the Philly Wellness Center. To find out more about the Philly Wellness Center and how we're challenging conventional medical wisdom and shedding light on more natural means of healing and therapy, visit phillywellnesscenter.com. And then make sure to search for Holistic Health in Apple Podcasts, Spotify, and Google Podcasts, or anywhere else podcasts are found. Make sure to click subscribe so you don't miss any future episodes. On behalf of the team here at the Philly Wellness Center, keep celebrating the innate power in our incredible bodies, and thanks for listening.